Hello everyone, today we're going to going through the cranial nerves, especially the olfactory nerve, which is cranial nerve 1. So just for a quick overview of the cranial nerves, there are 12 pairs of cranial nerves. Here you can see all of them. It's a very handy mnemonic to remember the order, which is once one takes their anatomy finals, very good vacations are heavenly. So that kind of corresponds with the first letter of the cranial nerve, and they'll help you to remember the order of it. Cranial nerves can either be sensory or motor. Sensory neurons are afferent, so that means the signal goes from the cell to the CNS, whereas motor neurons are efferent, so it goes from the CNS to the muscle or the kind of area where the nerve wants to have its effect. All of the cranial nerves typically arise from the cerebrum or the brain and the brainstem. Most of them are components of the peripheral nervous system, which is made up of the somatic and the autonomic nervous system. But then the exceptions are the olfactory and the optic nerve, cranial nerve 1 and 2, which are parts of the central nervous system, which is made up of the brain and the spinal cord. All cranial nerves are covered in myelin, which is produced by the oligodendrocytes, rather than Schwann cells, which would be produced by the peripheral nervous system. Now, the olfactory nerve is cranial nerve 1, so it is located in the forebrain and it originates from the cribriform plate. Here you can see on the kind of image of what I mean here. The cribriform plate is where the cranial nerves kind of originate from. From there, it's a first order neuron, so that means a smell or an odor directly starts and is the signal is interpreted by the cranial nerve, by the olfactory nerve. So what happens is airborne molecules from an odorous source is first going to be going through your nose, and it's going to be detected by the cranial nerves, which will then convert that into an electrical signal, which will go to the olfactory nerve, which will then go to the olfactory tract and is then interpreted by the brain throughout either the medial or the lateral olfactory area. Some of the kind of cells within the olfactory nerve include mitral cells, which are found in the olfactory bulb, as well as basal cells found in the olfactory epithelium. The olfactory nerve, therefore, helps to innervate your sense of hearing. So a very good way to test in the cranial nerve exam whether the olfactory nerve is functional is to ask the patient if there's been any changes to their sense of smell, or to give them a very strong smelling substance such as smelling salts or ground coffee to see if they can smell it. Some of the causes of anosmia, which is a loss of smell, could be naturally aging, because as naturally as we age, your senses, such as your sense of smell, becomes reduced. Trauma to the nose, or anything that can block the nose, such as a cold, a flu, rhinitis, as well as loss of sense of smell can also be an early sign of Alzheimer's and Parkinson's disease. Here's a question here, please have a go. Okay, so when answering a question, I always like to read the questions first. So which of the following nerves is most likely to be affected? So it says cranial nerve 3, cranial nerve 2, so the oculomotor nerve, the optic nerve, the cranial nerve 1, olfactory, cranial nerve 4, which is trigeminal, and cranial 5, abducens. Okay. So let's begin with the question stem. A 24-year-old chef comes to the surgery after being hit in the face with a football during a football match. So he's had trauma to the face. That means potentially trauma to his nose, his cheeks, his eyes. He claims that he's unable to take in the scent of his meals when cooking for his clients, and this is impacting the quality of his performance at work. You decide to conduct a cranial nerve exam. Which of the following nerves is the most likely to be affected? Okay, so the first option, cranial, is cranial nerve 3, trochleomotor, which is responsible for eye movements of the eye. So it can't be that, because even though he was hit in the face, his sense of smell has been affected rather than his vision. Cranial nerve 2, the optic nerve, same thing. It is a nerve which innervates your vision, so it can't be that. It can be cranial nerve 1, which is the olfactory nerve, which innervates your sense of smell. Cranial nerve 4, trigeminal, and abducens also have nothing to do with your sense of smell. So the correct answer is C, cranial nerve 1, which is the olfactory nerve. Thank you.